6:21 on the Wednesday edition of Jacksonville's Morning News, October 29th. Rich Jones and Christine Bellino, happy to be live on location again in the community as we are live from MD Anderson, Baptist MD Anderson Cancer Center, just across the way from Nemours Children's Health. And as I was pulling in, I had a Carathon flashback.
I did too.
Right across the street from Nemours.
I did too, for sure.
And in that effort, that's pediatric cancer across the way here in kind of our medical mile here in San Marco. Lives are being changed for the better because of the work that's happening. And for 10 years, Baptist MD Anderson has been in our community since 2018 in this beautiful facility. And we're visiting with Dr. Bill Putnam, who is the medical director here at Baptist MD. And can you believe that 10 years has already passed in this effort here? And you were recruited here 10 years ago, right?
That's right. Baptist came here to help set up the program at the very beginning, and Baptist MD Anderson Cancer Center was created as a partnership between the University of Texas MD Anderson Cancer Center and Baptist Health. So that partnership was really designed to bring world-class, multidisciplinary cancer care to Jacksonville. So you can get state-of-the-art, innovative, novel cancer care right here in your community.
A big deal to be able to say that 10 years has passed. Have you achieved all the goals or the vision? How have you kind of met the moment, and what do you see 10 years in as success?
Well, we've really been able to create a model of care here that really provides for each individual patient a personalized therapy. And with a multidisciplinary team of specialists, medical oncologists, radiation oncologists, surgeons, support team, nurse navigators, genetic counselors, dietitians, nutritionists. We've been able to surround each patient with the care they need for their cancer care.
So, Dr. Putnam, that sounds really good, kind of esoterically, but for the patient, that means that each patient's whole life is being examined by a team of doctors. The room that we were in, you were talking about before the broadcast. In this room, you discuss each patient from very different aspects. Is that correct?
Yes, we have a multidisciplinary cancer conference for each individual patient, so the team of individuals focus on that one patient's clinical condition, the characteristics of their cancer diagnosis, to really provide for the treating physician the very best treatment possible, recommendations that can be applied in a shared decision with the patient and the family, the best treatment for that patient.
So they really look and say, okay, this is what this patient is eating on a day-to-day basis. This is the kind of home that they live in. This is this family situation, in addition to all their diagnoses.
We include all that. It's important to include the medical side of things, but it's also important to include the social side of things as well, and to ensure that the healthy habits that are so important at every phase of our lives are maintained. Patients come to us at the most vulnerable time in their lives. We're very sensitive to that and really have been very much inspired by the special trust and confidence that patients and families have in our team, in our Baptist Health System, and with Baptist MD Anderson Cancer Center.
As you drive along I-95 or through San Marco, or you see any of the advertisements, you see the MD Anderson Cancer, and the word cancer is checked out, or a line goes through it. You mentioned, Doctor, that you're reaching people at the most vulnerable time of their lives. Psychologically, are you meeting that moment here in this community so families don't have to travel when the worst day of their lives comes on a diagnosis?
Our mission is making cancer history, and for each individual patient, having that care provided as close to home as possible is really key. Medicine should be done as close to home as possible, and we have a campus downtown, we have a campus at Baptist South, and we have a campus at Baptist Clay, all to meet the needs of patients in those communities. And we expect in the future that we'll expand even further to meet the needs of patients at the beaches and north toward Nassau.
Is that in the next 10 years, that expansion?
We've made so much progress in the first 10 years, hard to imagine what the second think 10 years will be, but I would expect that we would be in those communities within the next 10 years.
The
Yes.
sad part is you have to expand to meet the need, but this also shows the growing community that we live in and also the level of care that we have here.
Jacksonville's a vibrant community, and and so many people are coming into our city. We want to meet those needs. Sadly, we will take care of 10,000 new cancer patients this year, and to meet the needs of those patients and our future patients, we want to ensure that we provide the services and infrastructure for those patients.
Well, thank you for inviting us in today. Happy 10-year anniversary in Jacksonville.
Thank you.
Pretty awesome. Dr. Bill Putnam is the medical director here at Baptist MD Anderson Cancer Center. As Jacksonville's Morning News continues live on location this Wednesday